Welcome back to the Cash Practice Solution Podcast. In today's episode, we'll discuss one sure way, it's an old-fashioned way, to future-proof your practice against the impact of artificial intelligence. Granted, AI will reduce the need for some basic cognitive processes, but it's unlikely it's going to replace physician judgment altogether. I mean, I would say it's impossible. AI can't replicate the personal connection between the doctor and the patient. The doctor-patient relationship is kind of the key to everything, but kind of on low-level stuff, things that people Google now and have other methods to research, certainly it will replace some of that. But AI can't do one of the most important things that there is for a doctor, is that to actually physically touch a patient, make them feel like they're connected to the world around them, make them feel cared for. And they definitely can't perform complex procedures. I mean, that's just not happening. So, something that I've been doing my whole career and I find immensely gratifying is procedural medicine. And I'm an osteopath, so I do some manipulative medicine, but because not everybody has that skill or training, I'm not going to talk about that a whole lot. And what I will talk about is technology and how that is going to impact kind of everything in some ways, in a good way, and in some ways it'll be somewhat negative. There's only so much use for technology that doesn't create distance between the doctor and the patient. But hands-on procedures offer something that AI can never do. It's that personal touch that technology will never replicate. Not only that, in my practice, and I've been doing this for a long time, patients really appreciate the convenience of being able to receive everything that they need at our office in the same context as their office visit, doing their blood pressure medicine, and maybe they have a skin problem, or they have pain, or there's something else that they want to get handled. They don't want to come back again and again. And especially, they don't want to see somebody they don't know. They want somebody they trust, and especially if they can do it in one visit. And here's the thing, with a cash practice, you're not limited by the insurance company as to how many procedures you can do, or how often you can do them, and when you can do them, and whether or not you can do them at all, but by your patient's choice. And of course, what's right. We remember that outcome income thing. If it improves the patient's outcome, and it's neutral or improves your income, well, that's probably a pretty good choice. And almost all the patients that I work with far prefer to have the one visit and receive all the necessary services in that visit than making multiple trips. In fact, probably most people know this, in a Medicare setting, the procedure cryosurgery, which is getting a gun, which has a little liquid nitrogen in it and freezing off a very mild actinic keratosis or an early, real benign, slow-growing cancer, you can do one per visit, and that's it. And then the patient has to come back for another visit the next day or the following week, but they have to come back for a different treatment each time in order for it to be covered by Medicare. So, and you've probably seen this, some patients, they're covered with all sorts of questionable skin lesions. You want to take care of them. You want to take care of them early. Some people have as many as 30 or 50. So can you imagine making a patient come back 30 times? Or you can take care of it all in one visit. And our costs are reasonable. We don't charge a lot of money to do it, but we sure can help them out and keep them from having to spend the rest of the next month running back and forth to the doctor's office so they can have one little spot cryo. It doesn't make any sense, right? So procedures can be integrated into every practice. They don't have to be expensive. They don't have to cost you a lot of money to get in, and they can provide huge value. So let's talk about some procedures that are easy to incorporate into your practice. One of the ones that's the easiest, it costs about $1 for you, for the lidocaine and the syringe and the needle, trigger point injections. And arguably, pain is the number one reason that people come to doctors for care, right? And trigger point injections are one of the easiest things in the world to do. What I use usually a 3 cc needle, a little lidocaine with some bicarb, find the affected muscle, draw that solution out with maybe a 20 or 21 cc or gauge needle, and then shoot it with a 27 gauge needle, maybe an inch and a half, inch and a quarter. You'll see a little twitch response when you're at the exact point. There's a extensive literature about this. Janet Travell was kind of the pioneer in the field. And there's a map of exactly where they are. And it takes a little tiny bit of time And certainly in my case as an osteopath, I have a pretty good feel for tissue. I can find a trigger point and inject it in about a minute. And depending on how you choose to charge for it, that $1 cost to you can be $50 or $100 or whatever you think is reasonable and the patient agrees upon, right? That's so easy and so helpful. Trigger points can keep people in pain for years. Sometimes a single injection is enough to resolve the pain permanently. That's a pretty good deal, right? So trigger point injections, look at Janet Travell's stuff. Easy to get trained in it, takes a day, tops. Joint and tendon injections, a little bit more involved. Orthopedic specialists do it, of course, sports medicine guys, family docs. The whole spectrum of primary care docs should be able to do them pretty easily. You can do it with ultrasound, which is my preferred way, or without. I used to do them as a young doc without ultrasound, didn't have access to it. But joint and tendon injections are super easy. A little bit of dexamethasone and some lidocaine with bicarb again. Same setup, a little 3 cc syringe. Learn the anatomy and give an injection and give some tremendous relief to people. Again, that's maybe a $10 cost to you in terms of materials and $150, $200 procedure. And the patient gets what they need all in one place, all at one time. They don't come to you for their medication refill and then, I got this bad knee, doc. What could you do for me? Well, sorry, I can't help you out. Or you can help them out. Are there other things you can inject? Certainly, PRP, stem cell, all those things. Much more training required, and there's a little bit more cost involved, but of course you can charge more. So skin biopsy, super simple. Every doctor who's trained in primary care should be able to do them. A little bit of Lida with epi, a little bicarb. You can use a punch, you can use a shave, you can do a sharp excision, however you want to do it. There is a shortage of dermatologists, massive shortage. Huge waiting lines. Most skin lesions are not urgent. Melanoma, probably, unless you're super well trained, you should probably refer. But all those intermediate lesions, you should be able to handle them. You should be able to make a little biopsy, send it off to the lab for $100, and then be able to give that patient great guidance. Either they don't need anything further, you've completely excised it, or they need further treatment. And one of my favorites is hormone implants. I love doing testosterone and testosterone estradiol implants. Have been doing it for 20 years. And if you want to get a high level of patient satisfaction for treatment in a procedure that's easy to do, you've got to learn how to do hormone implants. It's very, very simple. There's lots of good training programs available, and you should avail yourself of it because patients need that kind of treatment. They appreciate that kind of treatment, and they will come back. We're going to talk about this in the next episode about recurring treatment and how that is the key to financial stability. And if you're super interested and you want to contact us at cashpracticesolution.com, we could possibly get you a training program that I've done. It's a whole day training program and maybe get you a copy of that. But subscribe and we'll see. Next year, we're definitely going to be talking about it in further depth. And then, of course, there is the cosmetic world, aesthetic procedures like Botox and fillers. There's a lot of people who are not really highly trained or I would even say highly qualified, who are injectors compared to you as a provider. Boy, you should really be taking advantage of the opportunity to do simple things like Botox. Botox especially, it's super simple. I mean, if you know the facial anatomy and the muscles, it's a simple procedure. Fillers are a little bit more demanding, and I like to be super conservative. And I'll treat a patient very conservatively, and then I'll have them come back for another visit and build on that filler. I don't want to turn somebody into somebody that they're afraid to look in the mirror. That's not good. But all these things are easy. They're easy to do, and they're so appreciated. Patients really, really appreciate it. Because you physically have to be involved in these procedures, they tend to be pretty high margin. In other words, you put in your effort, and because your time is worth a lot of money, you tend to make really good money. And I think most importantly, back to the outcome income model, patients really appreciate it. I've been told this by patients relatively frequently. Thanks for not taking insurance so you can actually take care of me and do the work. And once you start getting good at it, that starts to become a normal part of your day. where you fit that in. You can either have the procedure materials in the room or have a little caddy and bring them with you to the room, or have your staff bring them. And I recommend starting with really low-cost procedures. If you're not doing a bunch of procedures now, start with low-cost stuff. Some trigger point injections, some joint injections, a cryo unit for the Brimil gun, and a doer. It's $1,000, maybe $1,500, and you can make that back in a week. So that's a really good thing to consider. More expensive stuff, which I think is also so super helpful. On the low end, there's EKGs, pulmonary testing, those kinds of things. On the lower end, on the higher end, ultrasound imaging, it's coming down in price all the time now. You can get a really, really good unit for about $20,000, and with 2 probes and really comprehensive imaging capability. So you should think about that. Building a procedural practice, it's about more than just adding service. It's about creating the environment where patients feel like, man, I get everything I need here in this place. And at some point, you're going to get really good at integrating them into the day in terms of your scheduling and things like that. Training your staff's really important. You got to have the right equipment. You got to plan on training. There's a lot of ways to do that. You can learn the basics and kind of get familiar with the idea on YouTube, and then have someone actually directly guide you through it. See one, do one, teach one, that kind of thing. Most people who do procedures really have, a great willingness to help. So, and what you really want to do is find the procedures that your patients need and that enhance their experience of your practice, where they walk away from your practice saying, I really, really appreciate being able to see Dr. J or whoever it is, because that's the ultimate practice building tool. That's where referrals come from. People appreciate your care for them, and they tell everybody. It doesn't take long for people in the fast-paced world of insurance-based medicine for people to really have an incredible experience of your practice. So that's it for today's discussion on the importance of procedures, getting in there, touching patients, letting them know that you care. And it is the future of sustainable medical practice. AI is going to have an impact, and less of your cognitive skill will be required. You're still going to need it, and you can do straight cognitive medicine and still be helpful. But next time, we're going to explore something really great. It goes with the whole procedural gig. It's how to generate recurring revenue in your practice. That's one of the other keys to building a $2 million practice. So thanks for joining us. Thanks for tuning into the Cash Practice Solution podcast. I'm Dr. J, and I'm here to remind you that a fulfilling cash practice is within your reach, and we can help you get there. If you want to optimize your current cash practice or start a new cash practice on the right foot, check out all of our resources at thecashpracticesolution.com. So until next time, listen to your patients, learn their stories, and love them with all of your heart. You will be unstoppable.
Thanks for joining us. And if you have enjoyed today's conversation, be sure to hit subscribe so you don't miss out on future episodes packed with insights to help your cash-based practice thrive. And don't forget to check out all the tools and resources available at cashpracticesolution.com. They're free to you, and we're always adding more. Keep raising the bar in patient care. We'll reconnect in the next episode with more ways to help you succeed.